Hello guys, I want to share a story. It's about controlling blood work on my own and dealing with difficulties with doctors here in Belgium. This young man, Domin, wanted to feel better, so he put it himself on TRT, testosterone replacement therapy, thinking 175 mg of test and NSAIDs each week will be a total breeze. But that was not the case. Making the classic mistakes like using an AI anti-estrogen and provider news, crushing my estrogen into the single digits that way, and lowering my SHBG way too much to get more free T. Unnecessary, because free T is mostly way up compared to having natural test levels anyway. The TRT was a true hassle in the beginning. I found out I did not need the TRT that much actually. Although because of my varicose veins, my total T from blood work to blood work fluctuated a lot. The main driver of the difficulties I was having at the time was my thyroid acting a little weird. I share some training footage of me and my friends to make the content more palatable, exciting. Let's go. Later I could manage to get a full panel blood work of all my thyroid markers. It was really difficult here in Belgium to get it, but I got it finally. And then I found out with those blood markers I actually have or had a thyroid 6 syndrome. A mild case because I felt I was functioning just okay. The TRT was acting a bit like a band-aid during those days, but I was feeling sluggish almost daily, all day. I never forget the days I took for the first time some Armor Thyroid and I felt immensely better. I felt like my old self again. I felt like I was 22 years old again, and I could train hard, good in the gym, and then not feel beat up the rest from the day from it. I slept better. I slept better and longer, and I no longer felt sluggish or tired to get up from my bed. Let me explain in simple terms the thyroid mechanism. It's a feedback mechanism. So the pituitary gets signals from low levels of the blood of T4 and T3. There happens a bunch of things before the low levels of T4, T3 reach the pituitary, but I want to keep it simple, guys. In the thyroid, iodine gets trapped, coupled, etc. And what you get out of it is T4, that's a coupling of 4 iodines, and T3, a coupling of 3 iodines. So getting enough iodine in your food is important for proper thyroid function. So the pituitary sends signals to the thyroid to make T4 and T3 with TSH, thyroid stimulating hormone. T4 is the non-active thyroid hormone. T4 is active in some cells, but it is mostly T3 that is active, and T3 is the active thyroid hormone. T4 gets converted to T3 with an enzyme called deodenase. About 20% gets converted in the gut. The rest of it mostly gets converted from T4 to T3 in the liver. T4 can also be converted into reverse T3, and that acts like a spare bank, sort of, for the future. Reverse T3 and free T3 compete at the cellular level for their place. I will explain reverse T3 function briefly when I explain the euthyroid 6 syndrome. The thyroid glands produce about 80% T4 and 20% T3. The synthetic medicine levothyroxine gets prescribed a lot for people with thyroid problems here in Belgium. Levothyroxine, that is the synthetic version of T4. So for example, if you take 100 micrograms of T4 on a daily basis, because you have hypothyroidism, which means a slowing down of your own metabolism and your own thyroid function in your body, then most of the time it is better to take like the ratio 80-20, to take like 80 micrograms T4 and 20 micrograms T3. That is the more natural way actually. Classic doctors say you just give the body enough T4, titrate the dose up and down, and the body should know what to do with it. But most patients will not feel better when taking T4 only, and your body's ability to convert it to T3 is poorly. You could have thyroid conversion issues because if you have gut problems or liver problems, or a low SHBG, sex hormone binding globulin, in your blood, then the T4 does not get the chance to convert it to T3 properly. Doctors prescribe T4 because it is a safer compound to use than T3. It's the less active one. T3, it works immediately. In 30 minutes, it is active in your blood doing his thing. T4 takes like a week before reaching peak levels in the blood. When taking T3 in conjunction with T4 or running T3 solo medication, you should always start low because of being aware of the symptoms of a hyperthyroid. Those can manifest quickly when overdosing for your body. You can take two types of Cetamel T3, and that is a sustained release or a direct release version. I have experience with the direct release version. Good and bad experience with it. Side effects of Cetamel, and mostly these side effects are from taking too much for your body, are hair loss, increased heart rate, increased body temperature, hot flashes and such, and feeling a jittery sensation. Also feeling anxiety can happen. Good effects when taking the right proper dose for your body of T3 are weight loss. If you are overweight, it was not really the case with me. More energy, improved sleep, that I noticed a lot. Improved cognition, and decreased brain fogginess. Taking T3, you have to control your body temperature, and you have to keep your resting heart rate in check. That it in a rest does not go above 80 to 90 beats per minute. There is a widely variation individually how the bodies react to T3. You have people taking 75 to 100 micrograms of T3 and feeling just great. And you have people like me only needing 12.5 micrograms of T3 daily and feeling good also. The absorption rate of your own body also plays a role in how much T3 your body can handle or needs it. That's why they came up with the medication sustained release T3. It could be your body can't handle, for example, 25 micrograms of T3 in a single dose, but it can handle it very well and is actually the amount of T3 what your body needs of T3 at that time with a sustained release version. Doctors suck at reading the thyroid labs good here in Belgium. I got this from a YouTube channel, Dr. Westing Childs. Mostly they only check free T4 and TSH, thyroid stimulating hormone. But that way you don't know enough at all. If in the past I only would have checked my free T4 and TSH, then I would have never made the conclusion I have maybe a thyroid 6 syndrome. Doctors check TSH and mostly make conclusions from that single number or marker in the blood. TSH is important, but not as important as measuring also your free T4, your free T3 and your reverse T3. TSH just stimulates the thyroid gland to produce more thyroid hormones. The actual conversion of T4 to T3 happens in the gut and in the liver itself. So the TSH number will not influence that actual conversion of it. The actual conversion is too bad not measurable, but if a patient has gut problems with digesting certain foods, then that may lower the conversion of T4 to T3. 20% of the conversion rate happens in the gut. So if your gut doesn't work properly at all, your conversion rate can be 20% less effective. So people miss out on a lot of free tea that way, 20%. Best way to find out what foods agree with your body's digestion and what foods don't is doing an elimination diet and logging the symptoms into a logbook. Me, for example, my gut does not like eating red kidney beans and white beans in tomato sauce. My stomach and intestinal tract gets really annoyed from it and gassy with those foods. Most doctors read the TSH readings like this. So you're hyperthyroid if your TSH is less than 0.5. You're hypothyroid if your TSH is above 4.2. Why are you hypo if your TSH is above 4.2? Because your brain, your pituitary and your brains try to make a lot of signals to the thyroid glands to make enough T4 and T3. Why are you hyperthyroid if it is less than 0.5? Because it is not needed for the brains and pituitary to make a lot of stimulating signals to the thyroid. What is a normal TSH value? According to Dr. Weston Childs, a normal healthy TSH is actually less than 1 when not on a thyroid medication. When on thyroid medication, your TSH may fluctuate a lot based on taking certain T4, T3 medications. How to read thyroid labs properly? First of all, you want most of your lab work in the optimal range, because the reference range is a range made out of a lot of sick, unhealthy people here in Belgium. Most people aren't really that healthy if they're at an older age here. So, for example, if you go to the doctor and you explain you have hypothyroid symptoms like low fatigue, low energy, feeling cold, stuff like that, then your doctor can assume to check your thyroid. Most doctors just check your TSH marker, and they will say it is normal if the value falls in the reference range. Then they will probably say the number is normal. Maybe they will check free T4, but most of the time they don't do that. If you generally ask for it, they will probably measure it. What's important to check in your blood work, and more important than TSH, is free T4, free T3, reverse T3, your SHBG marker. Checking anti-thyroid markers is important in thinking if there is a possibility of having Hashimoto's autoimmune disease, especially if your CRP value in your blood is high. Vitamins like vitamin B12, vitamin D, and iron are also important to check for proper thyroid function. Most doctors assume if you have normal TSH, then it is fine. They focus too much on that solo number. But if your free T3 is lowish, and especially the ratio between reverse T3, the number of that marker divided by free T3, if that ratio is below 0.2, then you have probably low T3 syndrome. That stands for euthyroid 6 syndrome. That's the problem I had with my thyroid. Everything on that blood work seemed normal. Free T4 was at the low end of the range. Free T3 was really low, but still barely in the reference range. My TSH was 2.2, so that was normal. Unfortunately, I lost the blood work paper to show you. At my blood work, the reverse T3 was way up. It was not that high. I had like 16 or 17, if I can remember, on those labs. So anything above 15 on the reverse T3 number almost always means some kind of thyroid resistance. And the ratio between reverse T3 and free T3 was also skewed. SHBG marker is also important. SHBG takes the thyroid hormones through the blood to the liver, where it converts T4 to T3. 17 to 80 is the number for women is ideal. For men, anything above 25, 30 is good also. My SHBG was very low into the single digits due to my Provarin use. My conversion rate in the liver was poorly because of that. And because of all those markers, I started thinking into the direction of low T3 syndrome. I will try to explain in simple terms the euthyroid 6 syndrome. So the most important factor to know if you have low T3 syndrome is the ratio between reverse T3 and free T3. If that ratio is skewed, if that is below 0.2, then you have probably low T3 syndrome. So T4 converts to T3 or reverse T3, and those two compete at the cellular level for their function of action at the cells. Reverse T3, you don't want that. You want most of the T4 converted in free T3. Reverse T3 act as a sort of a spare bank for later on, but it has its function in the body. When your body needs a break, when your body is under extreme stress or illness, even acute ones. Most hospitalized patients who really need help, or if they come from emergency when they are really sick or under some sort of extreme stress, when bloods are taken to check thyroid markers, most patients at that time will have low T3 syndrome, according to their blood work. That's a big reason why they don't check thyroid markers in the blood, because the numbers will look, kind of fucked up, hypothyroid-ish. It actually means your body is going and shut down, converting all the T4 into reverse T3. Your body is trying to survive and beat the stress infection you have at that time. Your body tries to save the energy to combat it. That's why the reverse T3 goes up. Dieting hard, yo-yo dieting, makes the reverse T3 go up in the longer term. Chronic illnesses or infections, things like arthritis, Crohn's disease, can also have that effect. Same as chronic inflammation, gut infections, emotional stress. Leptin resistance, insulin resistance can all elevate your reverse T3. Certain medications like antidepressants, beta blockers like propranolol can have the same effect also. The best way to quote-unquote flush your reverse T3 to bring your reverse T3 down is taking T3 only medication. Armor thyroid is also key because there is free T3 in that. This way the conversion is boosted from T4 to T3, alongside with taking supplements like zinc, selenium, vitamin A. Those are important for stimulating the conversion from T4 to T3. Hormones that boost that conversion also and are really critical are leptin and insulin. If those two hormones are in check, work properly, your leptin sensitivity and getting your insulin sensitivity in check because of going low carb for a few days or fasting or doing cardio every day on a regular basis, taking supplements like berberine, metformin, fixing your insulin sensitivity is also key in making your conversion better. The biggest proof for me that I had low T3 syndrome was the fact that I found out that the ratio between my reverse T3 and free T3 was below 0.2. That was the biggest proof for me that I had really something going on with my thyroid and that it was not something acting up in my head like some doctors told me. How did I get into that stage? I was sleeping bad at that time, some nights just 3 or barely 4 hours, still trying to go hard in the gym, though that was not the best idea. I was having quite of emotional stress. There were things going on in my head during that time. I was dieting a lot too. That way your metabolism slows down quite a bit, especially if you are 20 days plus in a reasonable calorie deficit. And I had low SHBG. Those three factors led to low T3 syndrome in my body. How did I recover from that? I got armor thyroid at first, and after getting more insight in how to flush reverse T3, I got my hands on Turkish T3 Tyramel. That way I was feeling better almost instantly. I was back to feeling normal, just good, in about the timeline of just a week. So that was really amazing. Later, I upped my my T3 medication too much for my own body and got hyperthyroid symptoms actually. So brought it down a notch, of course. Now I'm completely off any thyroid medication for about 3 months, I think now. How did I get myself to go off is actually to get the basics better. The basics are actually being healthy. Important staples for every human being are 7 to 8 hours of sleep each night, reducing or trying to reduce as much stress overall as possible, emotional stress, stress at your job every day, a good diet with good whole foods, not that you can't eat shit, but not like the half of your diet every day is packed with processed foods. Daily low intensity exercise like walking, doing 30 minutes on the cross training in the local gym at a slow pace, And doing high intensity exercise, pushing yourself, training hard, at least 1 to 3 times per week at the bare minimum. When you feel like it. In the past, when I did not feel like training balls to the walls, well, then I did it anyway. It's actually better to listen to your body. And when you feel like you don't feel like it, just don't train or don't train that hard. But still do maybe something if you are doing a training plan, following a training plan from a coach or something. Also, taking some supplements helped in my recovery. Those are selenium, taking 200 micrograms daily because there is not anymore enough selenium in the soil in Western Europe to get it into the foods we eat. I take every day 10 milligrams of zinc also extra. I make sure I salt my foods with iodine salt. I get them probably around 150-200 micrograms daily, but not sure exactly. I take vitamin B100 complex because vitamins B are important for the metabolism, and vitamin B12 especially is important for energy and function at the mitochondria. Vitamin C I take 2 to 4 grams daily. Magnesium citrate I take 300 to 600 milligrams daily. 300 on non-training days before sleeping. On training days I take 600 to 900 milligrams.